Thank you very much. I'm participating online at this conference on HPV vaccination. It's an honor for me to present the experience of Côte d'Ivoire on the intensification of HPV vaccine. The Côte d'Ivoire is the country of Western Africa of 29 million inhabitants, and 48% is women. And we have introduced the HPV routine in 25th of November 2019 with the target of a young girl at age 9 years old. We have assistance of technical the JAGO and other partners. When we were at the introducing the vaccine, we had a COVID-19 that has stopped and slowed our work. And to mitigate the effect of the pandemic, we were supposed to, in the month of February and March, to elaborate a plan of in 7 regions to mitigate the challenges that we came, focusing on girls from 9 years old in that period of time. And the countries, in the strategy to catch up, we were trying to, we start working with girls 9 to 14 years old. Reason why the intervention that we have initiated are taking into account young women 9 and 14 years, and in the 9th of March we have targeted 158,000 women in 20 districts and 5 regions that we have 5 pilot region. The methodology that we have used in this intensification, we were supposed to train and scientists and stakeholders at 6 healthcare. We were supposed to meet community and religion leaders and the teachers to give them enough training on HPV vaccine and sensitize the application of women in the event of vaccination. We will also sensitize healthcare providers at the school setup, since more than 80% of those women are at schools. We were supposed to bring their attention on the activities. After that, we had a support of planning in terms of elaborating a plan in the schools and in the community and public places, work with the community and the responsible of schools in districts in which we were doing these interventions. After these activities, we had a outbreak. Every team had 7 days with the work with the girls at 9 to 14 years. We have community members to sensitize them, girls, on the importance of vaccination. We also have coordination and supervision with national program of healthcare in schools and the Ministry of National Education through their direction. And during these activities in the district, they made sure that of the activities, especially to strengthen coordination in a local level, meeting community and religious leaders for their commitment. This graphic is showing us coverage of 9 years old girls in the region. But in the strategy, we went we started with 9 to 14 years old girls in these 5 regions that we have mentioned. Before the strategy of intensification, the coverage of those one was at 40%, and those 2 went to 12%. And among other strategies, vaccination routine vaccinations that we have started in the month of May, the coverage went from 83% for those 1 to 73% of those 2, and we are noticing that in the term of second dose we are a level of 63%, which is something really considerable. This graph is showing us the coverage of the young girls from 9 to 14 years in the activities that we have launched in the 5 healthcare region. We have noticed that in Abidjan 1 and Abidjan 2, which is the capital city of Côte d'Ivoire, the coverage is beyond less than 30%. What is essential here is that 60% has received at least 1 dosage of HPV for the second intervention. Absolutely, we have recorded a satisfactory, but we still have challenges that we are addressing, like my colleague from Côte d'Ivoire that has spoken about the realization of vaccination. I'm not going to stay long on that, but just to impulse the vaccination. In routine vaccination, in our advanced strategy. In the advanced strategy, traditional vaccines are privileged, and HPV is not really being realized in advanced strategy. And we think that the work is still there, and after that I think we're going to optimize the work. Second element here is finding on scholarized, and it's essential for us because the program is allowing us to reach women in the community, which is really hard. And in terms of ages, doubting the age of the children because they do not have any ID, and especially the mobilization of community leaders out of this intensification. It is a big issue in the community level. We are still struggling to work, and the issue of integration is essential for us, and we are estimating that the intervention are really important for optimization of the vaccination. The lessons learned, we have learned so many things, and the essential ones are the following. First, the coordination between Ministry of Health and the National Education, and that's good coordination have made information easy, and it have prevented us to work in a silo. And we see this team to enhance or improve the coverage vaccination. The implication of stakeholders was really essential, and we have noticed that since the beginning of the process, the implication was profoundly favorable. And beyond the intensification, there's a contribution of impulse. And the sensitization is very essential. And we have experienced it in 2 health regions. We had a COVID campaign that was going on. And during intervention, the healthcare professional have exchanged with stakeholders on the vaccination of COVID and also HPV vaccination. And that has allowed healthcare profession to vaccinate children, because up to now, there's no administration. So the girls that were not vaccinated on the HPV and COVID, they will receive the vaccine of HPV. And that has allowed the team to have a number of women. So we think that everything regarding this integration is essential for the objectives. And the other point, it's about continued supervision. We have noticed a lot of supervision. We have strengthened the capacity for the updates on the vaccination and at both with the meeting we had with community leaders to have their commitment in the fight against cancer. The conclusion of our experience, our coverage, vaccination coverage in the 5 regions with routine vaccination, thanks to the intensification of vaccination activities. We had a coordination with 2 religion community, which really helped our work, and then launched the vaccination of routine in the 5 regions. And if we need to reach the coverage of 90% of OMS, of WHO since 2013, and realize intensification, that is going to be an efficient way to improve this work. Ladies and gentlemen, this is the end of my presentation. Thank you very much. Merci beaucoup, Séraphin. Merci d'avoir gardé le temps.